ulnar nerve. It is a chief nerve of the hand. It is also known as the nerve of fine movements or musician's nerve. Root value. Anterior primary rami of C8 and T1 and few fibers from the C7 spinal nerves. Important clinical relations. In the axilla, the ulnar nerve lies medial to the third part of the axillary artery. This is the third part of the axillary artery. This is the ulnar nerve. It lies medial to the third part of the axillary artery. In the arm, so in the upper part of the arm, the ulnar nerve lies medial to the brachial artery. At the middle of the arm or at the insertion of coracobrachialis. It pierces the medial intermuscular septum. It pierces the medial intermuscular septum. Lower part of the arm. It lies or it descends behind the posterior surface. Lower part of the arm. It lies or descends behind the medial intermuscular septum. At the elbow, it lies posterior to the medial epicondyle. At the elbow, see the nerve runs behind the medial epicondyle. There is a groove where the nerve is running. In the forearm, it enters the forearm by piercing the flexor carpi ulnaris muscle. It enters the forearm by piercing the flexor carpi ulnaris. So it runs between the flexor carpi ulnaris and here there is a muscle, flexor digitorum profundus. So it runs between the flexor carpi ulnaris and flexor digitorum profundus. The lower two-thirds of the nerve is related to the ulnar artery. So the lower two-thirds of the nerve lies medial to the ulnar artery. Lower two-thirds of the nerve lies medial to the ulnar artery. At the wrist joint, it runs superficial to flexor retinaculum. It runs superficial to flexor retinaculum. See, just above the wrist joint, that is 5 cm above the wrist joint, it gives a branch that is known as dorsal cutaneous branch. And at the middle of the forearm, it gives another branch known as palmar cutaneous branch. In the hand, the nerve runs superficial to the flexor retinaculum. The nerve runs superficial to the flexor retinaculum and divides into superficial and deep branch. In the hand, the ulnar nerve runs superficial to flexor retinaculum and enters the hand where it divides into superficial and deep branch. The deep branch runs along with the deep palmar arch present in the palm. The superficial branch supplies the palmaris brevis and ends by supplying the skin over the palm and the lateral medial 1.5 fingers. The superficial branch ends by supplying the palmaris brevis muscle and the cutaneous distribution over the medial side of the hand. Branches and distribution. In the forearm, it supplies flexor carpi ulnaris and flexor digitorum profundus, medial half of the muscle. So in the forearm it supplies flexor carpi ulnaris and flexor digitorum profundus, medial half. In the hand, okay, it supplies palmar interossei muscle, there are 4 numbers, dorsal interossei, 4 in number. Okay. Out of 4 lumbricals, it supplies medial 2 lumbricals, that is 3rd and the 4th lumbricals. The first and second are supplied by median nerve. And in the thenar muscles, out of 3, it supplies only 1 muscle, that is adductor pollicis. And there are 4 hypothenar muscles. Okay. All the 4 hypothenar muscles are supplied by ulnar nerve. They are flexor digiti minimi, abductor digiti minimi, opponens digiti minimi, and palmaris brevis. So these are the 4 muscles of the hypothenar compartment. Articular branch. It gives articular branch to wrist joint, carpal and metacarpal joints. Cutaneous distribution. So the palmar cutaneous branch, which starts in the middle of the forearm, runs superficial to flexor retinaculum and ends by supplying the skin over the medial half of the palm, Dorsal cutaneous branch, it starts just 5 cm above the wrist joint and it runs posteriorly to supply the skin over the medial half of the dorsum of the hand, including the dorsal aspect of the medial 1.5 fingers. The superficial branch and the deep branch, after supplying the muscles of the hand, okay, it ends by supplying medial 1.5 digits of the palmar aspect of the hand. Medial 1.5 digits or the palmar aspect of the hand. Applied anatomy. Injury to ulnar nerve results in claw hand. Claw hand. It is a condition in which the medial 2 lumbricals are paralyzed. So the medial 2 lumbricals, the lumbricals are responsible for flexion of metacarpophalangeal joint and extension of interphalangeal joint. So injury to ulnar nerve results in paralysis of the medial 2 lumbricals. So what happens? There is an extension of metacarpophalangeal joint and flexion of interphalangeal joints of the medial 2 digits. Whereas the lateral 2 digits are not damaged because the lateral 2 lumbricals are supplied by median nerve. So this is known as ulnar claw hand. Ulnar claw hand. Since the ulnar nerve is injured, it results in the paralysis of the adductor pollicis. Adductor pollicis. So this results in abduction of the thumb. You can see a gap on the dorsal aspect of the thumb and the index finger. And also adduction of the thumb is not possible. If you keep a great curve between the thumb and the index finger and ask the patient to grip, and if you test the muscle, the adductor pollicis, if you are trying to pull the paper, okay, it will come out. So in order to prevent the person affected with paralysis of adductor pollicis, slightly flexes his thumb finger for powerful grip of the paper. Since the adductor pollicis is not acting, it is activated by the flexor pollicis longus muscle, and there is a flexion of the terminal phalanx for the grip of the paper. The palmar interosseae are responsible for adduction of the finger and flexion of the interphalangeal joints, whereas the dorsal interosseae are responsible for abduction of the fingers and extension of the interphalangeal joints. So when there is damage to the ulnar nerve supplying the palmar interosseae, adduction and flexion of interphalangeal joints are affected. When there is damage to the dorsal interosseous muscle, extension and abduction of the fingers are affected.